Welcome to Eat Well with Kristen and Adele.
I'm Kristen.
And I'm Adele, and we are private practice dietitians from Palmerston North, and we're doing this video for Coeliac New Zealand. So today Kristen is going to help us figure out what to eat when we have diabetes and also celiac disease. Now Kristen, I've read somewhere that about 1 in 10 people with diabetes also have celiac disease. Why is that?
That's absolutely right, Adele. Both are autoimmune conditions and they share the same genetic background. And a diagnosis of diabetes or celiac disease in and of itself can feel quite overwhelming, but when you add both conditions together, it can really leave people feeling like, what can I have to eat?
Oh, come on, Kristen. Surely I can have a little bit of gluten because of everything else I've got going on with my diabetes.
Well, unfortunately, we know that even a little bit of gluten in the diet can make blood glucose levels more difficult to manage.
Really? Why is that?
Well, it has to do with inflammation in the digestive tract caused by gluten. It can just make for more erratic blood glucose control.
So does that mean higher or lower blood glucose levels?
That's exactly right.
So now what do I do?
Well, first of all, don't panic. Take a deep breath. It's going to be okay. The first principle is actually most whole foods are gluten-free.
Kristen, what are whole foods?
Whole foods are foods that are in their natural state or even minimally processed. So I'm talking about things like fruits and vegetables, dairy products, legumes like lentils and beans, nuts and seeds, meat, beef, chicken, lamb, fish, as well as some grains.
Now Kristen, if I can't eat my wheat, barley, rye and oats, what can I eat?
Well, actually, there's a lot of grains that are gluten-free, Adele. And the biggest one is probably rice. Rice flour is gluten-free, as well as brown rice. Lately, in the last 10 years or so, quinoa has become more popular, and people are enjoying that more alone or in mixes with brown rice. Also, corn is gluten-free, and so corn flour, whole corn is gluten-free. And for those people that feel more adventuresome, there's other grains like amaranth and millet and buckwheat. They're also gluten-free too.
There's actually quite a lot out there, isn't there?
There is, yeah.
Kristen, is there any special diet I need to follow if I have celiac disease and diabetes?
Well, Adele, the principles are the same whether you have celiac disease or not. So, having those regular meals, having plenty of low-starch vegetables, like our leafy greens, broccoli and cauliflower and onions and carrots and tomatoes. Having some lean protein foods like meat, fish, chicken, eggs, or tofu. Using healthy fats such as avocado and olive oil. And moderate amounts of carbohydrate foods like whole fruits, starchy vegetables such as potato and kumara, milk and yogurt, and gluten-free grains like the ones we just discussed, like brown rice and corn.
Great! So Kristen, is there anything special I should keep in mind?
There are a few unique challenges for people with diabetes and celiac disease that we need to keep in mind, particularly as it relates to glucose management.
So are you going to talk us through these challenges?
Yes, we'll walk through them now.
Wonderful.
Adele, one of the things we need to keep in mind is that many gluten-free products may be higher in carbohydrate than their gluten-containing counterparts.
Oh.
So an example of this is if I look at this just plain old wheat flour, if I look at the label, I'll see that per 100 grams, this flour contains 71 grams of carbohydrate as well as 2.8 grams of fiber.
Gosh, Kristen, and if I look at this gluten-free flour, it contains 82 grams of carbohydrates per 100 grams, and it's got absolutely no fiber in it. So does this mean, Kristen, that if I maybe use this flour in baked goods, my sugars might go up a little bit higher than if I use the wheat flour and I might need a bit more insulin?
That's exactly right. So that's something to keep in mind when you're switching over to gluten-free foods, is that they may have a different impact on your blood glucose levels, often higher than the gluten-containing counterparts.
Gosh, so I might need to monitor a bit more closely.
Another thing that we need to keep in mind is that many gluten-free foods are lower in fiber than their gluten-containing counterparts. And this is important because we know that a higher fiber diet is good for gut health, and for people with diabetes in particular, it also can impact their glycemic management.
So, Kristen, what can we do then if we can't eat our normal bread, cereals, and crackers and so on?
Well, there certainly are high fiber options that also are gluten-free, but we just need to be a bit more mindful about what we choose and substitutions we make. So, for example, instead of just having this white flour, as I already discussed, you can swap out for brown rice flour or products made with brown rice flour. Or you could use something like chickpea flour or even almond flour.
So does that change the recipes a little bit of the things you make?
It does. I mean, each type of flour kind of has their own unique properties to them and flavors as well. But it's good to know that those options are there. And actually, when you're looking at a label, if you're choosing some foods that are made with those products, you know that they're going to be a bit higher in fiber.
Oh, very good. And I bet there's lots of recipes on the internet nowadays for making different things.
Definitely. Millions of recipes.
Oh, great.
Other things that you can do is add fiber to your products. So a good example of doing that is adding, nuts and seeds, like chia seeds are great. I also have things like linseed, ground linseed. You can also get LSA, which is a really nice way to add fiber to your foods. You can add nuts and seeds or buy products with seeds like sunflower seeds, pumpkin seeds, and of course any type of nut is a really good source of fiber as well. When we're thinking about grains, like we talked about rice, and white rice is very highly processed. There's really no fiber in that. But if we swap it out for brown rice, we're getting more fiber in with our rice that we're having. And even the mixes like brown rice and quinoa, there's black rice, there's red rice, there's straight quinoa. I mean, all these options tend to be higher in fiber.
And delicious too.
Yeah. And then the other one is corn is actually very high in fiber. So products that are made from corn tend to be higher in fiber as well. So if we think about rice cakes, for example, I mean, if you choose brown rice cakes, they'll be a little bit more higher in fiber. But these corn cakes are even higher in fiber. And another one too would be like our gluten-free pastas. So many of them tend to be made from rice flour, which is very low in fiber. So choosing a gluten-free pasta that is made with, for example, this one is edamame beans, or you can get chickpea-based ones or black bean-based ones, or they're going to be higher in fiber because of what they're made with. And how can you tell if a food is higher in fiber than another food? Well, you can look at the 100-gram column. So for example, this rice pasta has 1.1 grams of fiber per 100 grams, whereas this one has 6.7 grams of fiber. And so this one is definitely higher in fiber. And when you are looking at the label, you want to choose foods, when possible, that have more than 6 grams of fiber per 100 grams.
Oh, great. Kristen, why do we choose the 100-gram column?
Well, the reason for that, Adele, is that foods have different serving sizes. So when we're comparing similar foods, we use the 100-gram column, so we're kind of getting like with like.
Okay, that makes sense.
I mean, in addition to what we've just talked about, the same principles around other foods also applies to increase our fiber content. So, instead of having juice, choosing whole fruit instead, having plenty of vegetables, leaving the skins on what's possible, that's going to increase the fiber content of our diet as well.
Now, Kristen, what do I do if I can't choose high fiber options?
Oh, well, we know, with highly processed foods like, for example, this rice cracker, that if we add protein or higher fat foods to a carbohydrate, that it slows down digestion and lessens the impact. So for example, if you have no choice but to have white bread, what you could do is add peanut butter on it, and that will reduce the glycemic impact. Or with these crackers, I'm actually going to put a bit of hummus on there. And that's going to have the same effect. Would you like one?
Oh, yes, please.
There you go.
Thank you.
And I'll have one myself.
Mm.
Cheers. On the other hand, there are some gluten-free foods that are actually lower in carbohydrate than their gluten-containing counterparts. So it's really important to be aware, again, of how much carbohydrates is in the foods that you're eating. The other thing that we tend to see is that people may be skipping the carbohydrate altogether at their meals because it's easier. So for example, if they go into a restaurant, they may have just salad and meat and nothing else, and that's significantly less carbohydrate in it than like a pasta dish, for example.
So does this mean I could run the risk of having hypos if I give myself too much insulin for these meals and not adjust it accordingly?
That's exactly right, yeah.
Wow.
So should we take a look at a couple examples
Yes,
of this?
please.
All right, so here we each have some cereal. I have a gluten-free muesli.
And I've got a gluten-containing muesli.
Okay. And we've poured out a serving size of each, which is approximately 40 grams. Okay, so Adele, how much carbohydrate is in your muesli?
So my muesli has got 25 grams in this little serving size of 40 grams. How much has yours got?
This one actually only has 5 grams in it.
Oh my goodness, so mine has got 5 times more carbohydrates in than yours.
That's exactly right, yes.
Am I going to give more insulin for yours?
No, Adele, that's how hypos happen. You're going to give yourself less insulin because there's less carbohydrate.
So more for this.
More for that one, yes.
Excellent.
Another example too is this pasta. So these are both gluten-free options, but it just shows that there's a huge variation in the amount of carbohydrate.
Wow.
So for example, in one serving of these edamame bean pasta, there's only 2.3 grams of carbohydrate.
Wow.
Yeah.
And there's 66.6 grams of carbohydrates in one serving of this.
Yes. The last recommendation we have is to be prepared, because in New Zealand, even though the food supply has come a long way in the last 20 years and there's a lot more gluten-free options available, it is still possible to get caught out if you're having a hypo without a gluten-free treatment. So you always want to have some gluten-free options on hand.
So what gluten-free hypo options can I have, Kristen?
Well, dextrose tablets are gluten-free, little juice boxes are gluten-free, a small amount of regular fizzy drink is also gluten-free. There are lollies such as Mentos, gummy babies, and gummy bears are also gluten-free.
So what about chocolate?
Well, chocolate isn't recommended for a hypo treatment for people with celiac disease or not, and that's just because the added fat in it delays digestion and you don't get the quick hit that you would from other hypo treatments that I just mentioned.
So no more Mars bars for me.
No more Mars bars.
Man.
The other thing though is to remember then to always have something on hand to follow up with, such as a whole piece of fruit or a gluten-free muesli bar or gluten-free crackers, something that's going to take a little bit longer to digest to help keep you up after your hypo.
Good. Thank you for joining us today. We hope you feel more confident in making food choices when you have diabetes and celiac disease. Again, if you become overwhelmed, remember to stop, take a deep breath, and remember that there's plenty of choices out there for you.
Now, it may take several months for the gut to heal and for inflammation to settle down. This means that your blood glucose levels may be more erratic during this time, so you want to monitor more and be in close communication with your diabetes team around your insulin adjustment.
This webinar is not intended to replace individualized dietary advice. For more information, book in with your diabetes dietitian for individualized guidance.
And be sure to check out the Coeliac New Zealand website for more information about celiac disease.
Perfect.
Ka kite ano, eat well.